Tánaiste, our hospitals are at breaking point. Several have already begun cancelling scheduled care to cope with overflows from record emergency department admissions. Yesterday morning, more than 515 patients were admitted to hospital but without a bed and left on trolleys or chairs in ward corners, corridors and waiting rooms. Last week, more than 1,800 patients were languishing on hospital trolleys. The Sáilte Hospital Group, serving the North West and West, is worst affected, along with Limerick, Cork and Waterford University hospitals. The cancellation of elective and often time-sensitive care is unsustainable. It will lead to the worsening of conditions, physical health and mental well-being. Last month, the CEO of the UL Hospital Group said, and I quote, "The Irish Patients Association is quite right to point out that significant reductions in scheduled care is not sustainable in the long term. The truth is that we need more staff, Tánaiste, and we need more capacity in our public hospitals, which this government and your previous government have failed to deliver. Consequently, many healthcare staff are considering leaving the service, and they tell me that all of the time. And it doesn't give them any pleasure to do it, but they say it because they don't feel valued, they don't feel respected, and they are burned out, Tánaiste. Day in, day out, healthcare workers are dealing with crisis after crisis on the front line. They forego lunch and annual leave because they know that if they take these, they will heap more pressure on their colleagues and cause patients to suffer. And this level of moral injury is unsustainable and unacceptable. And you will have seen, Tánaiste, people on the front line, nurses, protesting outside some hospitals recently because of unsafe staffing levels. What is the government's plan to address the appalling working conditions to help retain our highly skilled healthcare workers? I am also hoping that you can confirm, Tánaiste, your government's intention to address the issues raised by student nurses and midwives who are again protesting outside the Dáil today. They should not have to protest. It is absolutely disgraceful that people who are trying to do their best in our health services have to come to the Dáil to protest to get your Minister for Health to act on what has been a long-running sore and a long-running issue, which is fair play and fair allowances and pay for those student nurses and midwives. A temporary pandemic payment was put in place at the end of this academic year, but we need a permanent solution. That means, yes, a permanent solution for those fourth years, but also for first, second and third years as well. I am shocked but not surprised that the Irish Nurses and Midwives Organisation and indeed other healthcare trade unions learned of changes to the intern pay rates in the Irish Times this morning, the same as everybody else. This is an industrial relations issue. They should not have to wait, Tánaiste, to read it in the newspapers. There should have been discussions with the public health trade unions, and yet that's not what happened here. Tánaiste, what's happening is unacceptable. Students outside are telling me in their droves, and I've met many student nurses and midwives over the course of the last year, they want to work in our public health services. They want to be part of making sure that we deliver the very best world-class healthcare services that we all want. But if they don't feel valued, if they don't feel respected, they are going to leave. And we need to recruit more nurses and we need to retain more nurses. So I'm asking you, first of all, Tánaiste, when will the McHugh review be published to give clarity on its recommendations? Will there be discussions and negotiations with the Irish Nurses and Midwives Organisation and other healthcare trade unions so that fair pay and fair allowances can be put in place for student nurses and midwives?
Tánaiste, please.
Thanks very much, Deputy. I think for a lot of our society, when it comes to the pandemic, things are largely back to normal. A lot of people are able to go back to their workplace. Schools are open, colleges are open, shops are open, businesses are open. But for our hospitals, the pandemic is as bad as it ever was. 500 people in hospital today, nearly 100 in ICU. Hospitals trying to manage COVID care as well as regular health care, and there's a big backlog of unmet need given the fact that non-COVID care was reduced so much during the initial phase of the pandemic. So hospitals are very busy at the moment. People in our hospitals and across our health service are working extremely hard, and we do face into a very busy winter as we try to manage the pandemic as well as regular care, as well as people who have unmet need because it wasn't met during the pandemic. We acknowledge the extraordinary work of all our health service workers in that regard. In relation to the issue of student nurses, which I know the Deputy has raised and has a real interest in, it's the Government's policy to protect and support continued education of all students, including student nurses and midwives. A longer-term review of matters related to student nurse and midwife allowances and internship pay has been conducted by Mr Sean McHugh. I'm advised that the Minister for Health, Stephen Donnelly, will be outlining his plans regarding this report shortly, and that these plans include a 12.5% increase in payments to student nurses and student midwives in their internship year, and also a continuation of the pandemic placement grant. Backdated payments may be required back to October. While they're on their clinical placements, student nurses and midwives in years 1, 2 and 3 and the first semester of year 4 continue to receive a weekly accommodation allowance of €50.79 per week, as well as reimbursement of their travel costs. Supernumerary student nurses and midwives also received an additional and exceptional pandemic placement grant during the academic year of 2020 to 2021. This was designed to support them with undertaking clinical placements during the pandemic. As the pandemic is still continuing and staff and hospitals face particular challenges, the pandemic placement grant will now continue to be paid, and the Minister for Health will announce details of this shortly. The pandemic placement grant was introduced by the Minister as an exceptional payment to support students attending clinical placements during the last academic year. But as the pandemic is still ongoing and staff and hospitals continue to face particular challenges, this grant will now continue to be paid, and Minister Donnelly will announce further details as soon as possible.
Well, first of all, Tánaiste, we'll have to wait and see exactly what is in the memo that the Minister brings to Cabinet. But the reality is that there has been 3 meetings with the Irish Nurses Midwives Organisation and the HSE. And this is an industrial relations issue. And yet that healthcare trade union and those student nurses and midwives outside the Dáil had to read in the newspaper what may or may not be in that memo. So I'm asking you directly, will there be an engagement with the Irish Nurses and Midwives Organisation on precisely what is in the memo? And you've outlined what might be in place for first, second and third years, and it is unacceptable because this is an emergency pandemic payment of €100, which many of them said fell far short. There's no sense that this will be permanent. There's no sense that there is any permanent solution being put in place for first, second and third years, and I don't believe that you get it, Tánaiste, because if you were outside today, like many of us were, talking to those student nurses and midwives, they are telling us directly, and it doesn't give me any pleasure to say this, but they are saying they don't feel valued and the first chance they get, they'll be gone. So let's avoid them going. Let's treat them fairly, treat them with respect, and can you please also explain when the recognition payment that was so promised for those on the front line and in healthcare will be paid? We heard about it before the budget, during the budget, a lot of talk about this exceptional payment for those on the front line in healthcare, and we've heard nothing since.
Thank you, Deputy. Tánaiste.
Thanks, Deputy. There will, of course, be engagement between the Minister of the HSE on the one hand and the Irish Nurses and Midwives Organisation and SIP2 Health on the other in relation to this issue of student nurses and student midwives, which, as you say, is an industrial relations issue, and it's appropriate that there should be further engagement. I don't know if Minister Donnelly will formally bring proposals to Cabinet, but there is a Cabinet meeting on Thursday and one again next Tuesday, so I'd imagine it's going to be quite soon. The proposals that are being made in the report provide for a 12.5% increase in the payment to student nurses and student midwives in their internship year and a continuation of the pandemic placement grant, recognising that the pandemic is ongoing and that may need to involve some back payments as well. I think it is worth pointing out that the only healthcare students who are paid salaries are student nurses and their midwives in their 4th year and are paid between 21 and 22,000 on an annualised basis. During that 36-week internship in 4th year, they're counted as a 0.5 full-time equivalent staff as they've not yet qualified. In terms of recruitment in the round, it's worth acknowledging that we have a health budget of €22 billion now, 50% higher than it was only 6 or 7 years ago. On a per capita basis, probably one of the highest in the world, and the HSE has recruited 7,000 or 8,000 additional staff since the pandemic and has authorisation to recruit a similar number again on top of that, and is doing a good job in recruiting as many staff as possible, notwithstanding the fact that we face recruitment and retention challenges which are a feature of all health services.
Tánaiste